Ben, tonight we continue our discussion on inequalities by taking a look at the disparity facing African American mothers and their babies.
In Milwaukee and Wisconsin, the mortality rate is among the worst in the country. As SHAUN Gallagher explains, it's something that hasn't changed for generations.
It's a shocking statistic. Black mothers and black children are 3 to 4 times more likely to die during childbirth or within the first year of their life compared to their white counterparts. However, this is not a new statistic. In fact, it's largely unchanged for the last 60 years.
It destroys African American families.
TONDA Thompson is an advocate for healthy babies. She was inspired 7 years ago when she lost her son.
All the work that I've been doing was in honor of Terrell and God.
And nearly her own life during the birthing process.
Everything was perfect until we went to the hospital. And, and my family was destroyed from that.
After some 41 hours in labor, doctors decided to do an emergency C-section, but it was too late.
It went sour. Everything was perfect until that day. My son only lived 17 hours. He died from labor complications that could have been prevented.
TONDA points to the statistics as proof of why this happened. The Milwaukee Health Department's most recent report shows African American children die at a rate of 15.4 per 1,000 live births. That's 3 times higher than their white counterparts, at 5.1 deaths per 1,000 live births. If you were white, would you and your son be here right now?
Oh my, if I were white, I would have had my baby at that facility that I had it. We probably would be in Grafton somewhere. My baby would have survived, definitely.
TONDA says as a black woman, she felt she wasn't being heard. Today, she says she would hire a doula, basically a birthing coach and advocate for both the mother and child.
Birth is happening right now in a system that often misses when people have needs.
RAVAE SINCLAIR helps train doulas through Birth Connections MKE. She says their work can help African Americans who already face disadvantages in the healthcare system be heard by medical professionals.
We want to protect this family. We want to protect their experience and their memory. We want to preserve their health. And it is a gap filler that can be incredibly powerful in terms of saving lives.
We need voices, we need strength, we need, like I said, cultural humility, having people that looks like us and that understand our bodies within that same field, people who aren't oblivious to, racism.
Last year, Governor Tony Evers included $28 million in his budget for the Healthy Women, Healthy Babies initiative. The program hopes to bring up to 100 new doulas to Milwaukee. We've provided more information on Milwaukee's efforts to lower infant mortality at TMJ4.com. Just look for this story. In Milwaukee, SHAUN Gallagher, TMJ4 News.